Welcome to What's My Tagline, a show where we put the microphone in front of the people who are typically behind the scenes, those responsible for marketing, sales, social media, PR, and event management. Hi, I'm your host, Carol Flagg. Tune in to hear a wide variety of guests on the show share challenges, best practices, or lessons learned in roles that are vital to the health of any organization. So let's start the show. Hello, and welcome to today's episode of What's My Tagline. I'm your host, Carol Flagg. Thanks for tuning in. My guest today is Megan Antonelli, founder and CEO of HealthIMPACT Live. In her career, Megan has launched and managed literally hundreds of healthcare events. And as we've moved past ViVE and HIMSS, two of the largest events in our industry, Megan joins me today to discuss the role of boutique custom healthcare events and how her company impacts and informs decision makers. Megan, welcome to the show.
Hi, Carol. Great to be here. Thanks so much for having me.
Yes. I've been looking forward to this for quite a while. I'm glad we were able to sync up our calendars.
Absolutely.
Yeah, you're a busy person. Megan, fair warning, and all our listeners know before we actually get started, talking about what we're going to talk about today. As always, my first question of all my guests is, if you had to describe yourself as a tagline, what would it be?
Well, what a great question. I love the name of the show, and I love having to think about this a little bit. And, maybe in not being humble enough, but I think my tagline, as I have said before, is I know healthcare.
Yeah. Well, given your history, I can understand why you have that tagline when it makes a whole lot of sense, basically. I think that as a founder and CEO, and again, you've been in healthcare for a number of years, involved in
say it almost 30.
Okay, 3 decades. That sounds better, don't you think? Like 3 decades.
I don't know, it all sounds pretty bad.
Yeah, you've been in healthcare for 3 decades. Again, hundreds and hundreds of healthcare events that you've managed and put together, and you're connected to just about everybody that I know, and especially in the health tech and health IT space. So I'm really looking forward to talking about, this idea of these more boutique, intimate, I guess, healthcare events that you and your company produce. But ahead of that, and we're also going to talk about the differences too between those sorts of events. And again, these, we just got that past ViVE and HIMSS and these, behemoths of events in our industry. But before that, tell our audience a little bit about Megan, your journey. Just spend a few minutes giving us the Cliff Note versions, I guess, of your journey through healthcare and how you got where you are today.
Yeah, well, I like talking about other people and promoting everyone else, but
I'm with you on that.
I'm more that behind the scenes, but lately it's getting more and more like this, and starting to enjoy it, I guess. So, but I got to healthcare. I grew up, sort of always wanting to be in healthcare, and was pre-med, like so many of us who are in this. Studied for my MPH, and was working in a hospital. Started my career at Columbia Presbyterian up on 168th in Broadway, doing research, and at the time studying for my MPH, and kind of realized I didn't like working in hospitals that much, and maybe being a doctor wasn't the best option given how much work was involved and be ahead of me. I also wasn't great at organic chemistry, so
okay.
So I fell victim to that barrier. But ultimately, and to date myself, I found a job in the New York Times classifieds for an event producer in healthcare. And I didn't really know what it meant. And I showed up and I got the job, and ultimately I loved it. I tried to leave a few times. I left, I went to Kaiser, moved to California, worked there. I worked at WebMD for a number of years, Medscape and then WebMD when they got bought, which was such an amazing time to be there. And I met a lot of incredible people who were really at the forefront of digital health at the time. And, in doing that, also with my studies at Columbia and the people I met along the way, I ended up going back to events and starting to connect them. So when I say I know healthcare, which sounds a little cheesy and a little arrogant anyway, but it's the knowing of the people and understanding the different stakeholders and being able to kind of build that community, connect them, that just kept bringing me back to events. And, I managed pharmaceutical events for years, insurance, Medicaid managed care events for a number of years. And then, I guess almost 15 years ago, started the HealthIMPACT event, in the face of kind of, hospitals, being at this tipping point of digital transformation. And, the rest is history.
Yeah. We've had this conversation before. Roberta and I got into healthcare in 2009 with the passing of the HITECH Act and our first website, HITECH Answers. And so, it's been that same thing, about a 15-year curvature, right, through healthcare, as obviously the HITECH Act accelerated EHR adoption and bring us into the digital age. And as those 15 years have gone by for both you and I, my impression, and perhaps your impression as well, is that there is always something to be looking at and talking about and connecting with and having a worthwhile dialogue around healthcare and what we're experiencing, not just yesterday, today, but also tomorrow for the future.
Absolutely. I mean, sometimes it feels like we're still having the same conversations. And in some cases we are.
Interoperability for one. I'm going to throw that out there. Right?
But it is changing and it's evolving. And what is so interesting is, even though sometimes we're having the same conversations, we're often bringing different people into the room. And there's always new people to educate about healthcare and the complexities that exist, both with, payment models, access, and, just medicine in general, organic chemistry. It's complex. So so that's where the joy to me comes from, is that there's so many points of education, and there's so much change that needs to continue to happen,
So tell our audience about HealthIMPACT Live. I know, obviously, a little bit about the company and the kind of events you produce, but give our audience a rundown, because they're not just. Let me back up one step. They're not just, this event this month. They're all pretty much the same, and you just wash, rinse, and repeat. You actually do a number of different kinds of events. So give us a rundown of the types of things that you do, you and your team.
Absolutely. Yeah. I mean, and I think of it as, it is a year-long engagement, and, it's, bringing people together as the market and healthcare needs change. But, I think when we started, it was regional forums, on a monthly to quarterly basis in New York and Chicago, California, Texas. We really followed all the hospital markets because it was a very specific time where the hospitals were looking to implement and get to meaningful use. And that was what we were born of. And as that's evolved, and of course, even through the pandemic, that we went virtual. So then we got another channel and another way to connect people and another way to amplify stories and what work was doing. And during that time, it was so important to tell, to share what everyone was doing. And it was amazing to me that people wanted to, the virtual platform, while maybe by the end it got rough, it was, such a great way for everyone to share. And now it remains, it's such a wonderful way to get a depth of content that it's a little bit harder to do in person and live now. Live and in person is still so important because of the connections. And we've been incredibly lucky. And I know, Shahid Shah as our moderator and MC, and he's literally, he's the best MC there is. And he does such an incredible job engaging the audience, engaging the speakers, and we always say it's a no BS event. We get beyond the hype, and that's to his credit. I get everybody there. I give them sort of a framework, but he gets them to really share the real stories and, actionable content. And that's what people walk away with that is so special.
Yeah. And the content for each event, whether they're your in-person events, which again I would characterize as boutique, they're in-person gatherings, or they're virtual. They're very topic driven, and you bring some really hefty guests and speakers on, with an idea, of course, that the audience itself is very provider driven, hospital driven,
Mm-hmm.
C-level driven, right?
Yeah, I mean, I'm incredibly lucky to have been able to meet the people that I've met through the connections that I've made over the years. And, some really great friends, and who have gotten to amazingly high places in the 25 years. And so being able to talk to them, I mean, it's just great. We used to make calls and do research for events and get people on the phone, and every once in a while get lucky, and then, occasionally fax them the notes from the conversation. That's how old I am. But, it's send it over in a tablet.
That was pre-Slack. Okay.
But to be able to just, call Chris Ross from Mayo Clinic and say, what are you working on? Or, Dr. Halamka and the number of other guests that we have who, and then join us for dinner. We launched the dinners that we do alongside our own events, as well as some of the major events. I guess probably about 10 years ago, we started doing those, and they're such a great way to bring people together when we're at these bigger events, to kind of share and connect. So those dinners, have been kind of the foundational piece of, what then becomes our events throughout the year. And, we're super excited to be, hosting another event in June with our partner at Microsoft in New York. So, it's all built up. And again, it's really about, connecting those folks and building the community around it.
Yeah. Yeah. So these in-person events, they're obviously meant to bring, top industry thought leaders to the table, having these great conversations. Obviously Shahid is moderating these conversations, and he is a wonderful MC, and full transparency, the host of a show on our network called Trending Now. So we know how wonderful he is. So these are these in-person events. I know they move from city to city, like you said, Houston, New York, LA, and then the dinners that go along with them. And then you also have a virtual component to bring these conversations and discussions in the virtual arena.
Yeah, I mean, it's been so great, especially, it just as part of, our preparation for the events, to be able to interview people for the Digital Health Talks podcast. And then, as you mentioned, we're just coming off of ViVE and HIMSS, which, I love all events. I love them big, small, medium. And these, having health and ViVE be sort of a new entrant to the event community, although it's, I guess it's now been almost just over 5 years, but
it has been,
which is crazy,
health.
but it was, a few years of the pandemic, which is a bit of a time warp. But the they've really, they've raised the bar in terms of kind of content and bringing multi-stakeholders together. And certainly, from an operations and just sort of show standpoint, really making it a fun and great event. And then, HIMSS obviously is such an important part of this industry, and, continues to be so. So being able to be part of those and, kind of go and meet people and do our podcast there has been amazing as well. And it's all very important. And I think our meetings, which are in fact, more intimate, but it is, it's just a different part of everybody connecting, right? I mean, you can go to one where you meet with lots of people, but then some of the conversations that you can have at a smaller event are often, and that is the goal, to be more meaningful, where the speakers are really there to engage and be in the room with the partners.
Yeah.
So, and it's a fun part of that.
Yeah. They're not, they're not just a keynote speaker on a stage. They're actually, roaming the room, talking with the attendees. And it is a much more, it's a smaller party, like there's, HIMSS and ViVE are, they're like Mardi Gras, right? You go and there's like, 15, 20,000 people. And I think that as somebody who's been going to those events for years, it becomes a matter of, I think, maximizing the little bit of time you get to spend with folks, right? But at the kind of events that you and your team create as part of Health Impact Live, those are really meant to be a deeper sort of conversation. Obviously, the idea is we're going to be having a longer dialogue and, like you said, a more meaningful, getting back to both of our meaningful use days, about what's going on in this particular challenge in the industry. And I think that is wonderful, especially this idea that you're taking again, the who's in the healthcare industry, and the attendees and the people involved get access to that person.
Right. Yeah, no, it is. It's and I think events, during the pandemic, certainly they were missed, and I think there's been so many different channels, and there is so much content available. And of course, even the platforms that we use on social, like LinkedIn, have changed over the years. And that time that you spend within an event talking about the topics and hopefully getting the takeaways, and we really do try to document what's said, and in our boardrooms, we are, walking out of there with white papers and things that we can, kind of look back on, or at least executive summaries. I sometimes say white papers, and I think that sounds a little bit more than what we really produce. But the outputs, that there's something tangible. And, there's a lot of discussion, about, are we just kind of preaching to the choir in some of these rooms, right? And does it get a little, stale, or is it just, sort of a lot of promotion and kind of what have you? And I think, it is all what you make of it. Right. And I've recently been talking to folks who, have attended our events from our sponsor side, right? So the partners, and one, who literally said that our event that they attended in 2019, they walked away with 4 or 5 hospital, relationships, and then, closed that business within months. So it's amazing what happens. I sadly, I tend to just go to the next one, and we're trying to do that less, right? In that there is this kind of continuous conversation and dialogue. So we're trying to connect the dots, and we've launched kind of a program partner for our sponsors that is a bit more of a, engagement, so that we're really partnering with them on their marketing and their event participation at all of our partner events, right? We're partnered with the ATA and HIMSS and Health, and, we want to see them, I'm a very big believer in it. There's abundance, even though, healthcare is a very tight resourced market. There is, you have to have a place at all of them. It's just choosing the right activation, basically, and that we're here to kind of help with that.
Right. So it's not not that these events, whether they're big or small, are one and done kind of events. That's not the purpose of ViVE, HIMSS, or even the events that you put on. But there is, I think, what you're alluding to. There is this sort of mindset that whether you're an attendee or whether you're an exhibitor or you're a sponsor, that event is over, on to the next one.
Mm-hmm.
Right.
Yeah.
Yeah.
Which can, and I do think as the industry, ultimately has matured. So when we came to it, all conferences were more content driven. They were attendee revenue driven. There wasn't as much sponsorship. You had trade shows, different, right?
Sure,
those were big halls and all that. But this convergence that has happened, where you're having both, and of course the, sort of hosted buyer models and things, all of them provide value depending on where you are as a company, in terms of who you're trying to meet, so it is again, just like picking that, picking the strategy and doing the right thing at the right place. But if you go to a smaller event and you treat it like a trade show, you're not going to get the right value, right? So it's about partnering and to ensure that, the right people attend those meetings to get the right connections, and so that you walk away ready to do more business.
Yeah. And understand that, certainly in those smaller events, I think the peer relationship becomes even more critical.
Yeah. Well, I mean, and I think then, and it is in terms of these events and the content that is shared and the conversations that are had and the community, the healthcare community is small. A lot of healthcare is local. And in order for hospitals to be able to really leverage the power of technology and to move forward, we have to share our best practices and, sort of stand on the shoulders of those who have done it before and, get there. And while competition is alive and well, both among the, innovator community as well as the health systems, my goal has always been, and that's where, sort of I come to it as this connector, is I want the stakeholders, whether they're pharma or payers or providers, to be talking about how to move healthcare forward for the patients. Because when you're just talking to one group or the other, the change that you can make and the impact is smaller and it's isolated. So it's these connections across the stakeholders that are so important.
Yeah, of course it's depending on where you are, it's a Venn diagram for everybody, right?
Mm-hmm.
And obviously the challenges are different for perhaps a small hospital in a rural community than one in a big hospital in New York City, like a Mount Sinai, or like like you were talking about the Mayo Clinic, and these sort of hospital systems that are well-known branded names in the industry.
Right.
But there are commonalities that bring it together. And I think that when I look at your past events and then what you've got going on coming down the road, I think that is the thread that you guys pull, right? In that you find a commonality that brings these people together.
Yeah, we try, I think, we hear often on the stage and elsewhere, it's, you've seen one health system, so yeah. for how to go through it. But, I think that's, now one system just buys the other health system. So it's becoming less of a problem, and figuring out, how to navigate and work within these health systems to make, positive change. I mean, the reason I love healthcare and I've stayed in it forever, except for that one time they made me do an oil event that I didn't like, but it's not right for me. But everybody comes to healthcare because they want to help patients and people, and everyone, whether you're pharma or you're an insurance company, and of course, if you're a physician and a clinician, and healthcare is good people. And so when you bring those people together to help patients, we're all working for the same goal. Everyone has different reasons and beliefs of how they get there and how their company is going to stay sustainable to get to that place. But we all come there for the same reason and stay there, because it's not an easy business to be in. It's not the easiest industry. It's not an easy job. Yeah. So it is, but it is good people.
Yeah. So Megan, believe it or not, we've only got about 2 minutes left here in our conversation. That went by fast. So you already mentioned the June event at Microsoft in New York. What do you got coming up over the summer or in the fall?
Yeah, so we'll be, as I said, HealthIMPACT in June. That is shaping up to be what is going to be a great event for this year. We have some great partner events coming, and every month on the third Thursday, we have HealthIMPACT Live, where we do 3 hours of virtual content. And then, of course, the Digital Health Talks podcast. And we will be having some boardroom meetings and dinners in the fall.
Yeah, you got a lot going on. You really do know healthcare, by the way. But I do love the fact that you know healthcare people. That's wonderful. Megan, thank you so much for your time today. It was great chatting with you, and I look forward to seeing you down the road.
Absolutely. Thanks so much, Carol. Always a pleasure.
Yeah. You can learn more about Megan Antonelli and HealthIMPACT Live at healthimpactlive.com. And be sure to follow her and the company on LinkedIn. You can learn more about this show on the program page on healthcarenowradio.com, and be sure to connect with me on LinkedIn as well. Until next time, I want to know, what's your tagline?